Hello and welcome to Youth Assembly. My name is Sylvia Ishime. Well, it's a new week and we hope that this new week brings forth good tidings to you. All right, I'm not alone today on Youth Assembly. I am with a doctor and we are looking at how to tackle medical negligence in Nigeria. And my guest is Dr. Chuma Mac Olex, who is a healthcare management consultant and also a specialist mental health practitioner. Welcome, doctor. Can you hear me, doctor?
Thank you. Good morning. Glad to be with you.
Yes. Okay. So we're looking at how to tackle medical negligence in Nigeria. And we'll start off by even defining what medical negligence is and even the stories what we've witnessed in recent times in Nigeria. The story of
Yes, I can. I can hear you loud and clear.
Okay, so Peju Uboma, a popular pastry chef in Lagos, was died after she had a surgery, fibroid surgery, and also Omolara, who died as a result of medical negligence after doctors or nurses gave her an overdose of injection. Now, these are cases that have happened in recent times, and people have been coming out to tell their own stories of how they've been neglected or what sort of negligence coming here and there in hospitals. And so we look at the question: what amounts to medical negligence in Nigerian hospitals, and how can it be tackled? So, doctor, we hear the common quote in hospital buildings: "We care, God heals." So, how much of the care are Nigerians getting from the hospitals? And in your case, what would you say is responsible for this stories coming out in recent times? Dr. Chuma. Okay. Okay, while we get Dr. Chuma to get speaking, this is interactive, and so we'd like you to contribute.
Thank you very much for that.
And answer
thank
the question,
you for
how
bringing me on board this program to look at these issues. I think it's important to start off with that we, as a whole, understand that doctors.
Okay, we lost the connection there. So the question we put out is, what do you think can be done to tackle medical negligence in Nigerian hospitals? You can drop in your questions or comments. And if you have stories to share, you can also share at this point. While we await the doctor to join us again and tackle this issue on Youth Assembly today. Please bear with us. All right, so we already have comments coming in. Better Victor, thank you for your comments, Victor. I think hospitals need to be monitored by government agencies. A survey can be carried out by asking questions about the activities of the hospitals from people in the locality. If the hospital is found wanting, they must be fined heavily. Okay, so that is also looking at an issue and looking at how to tackle it, getting them fined if they've been found guilty. Thank you, Better Victor, for your comments. All right, so we'll get the doctor to respond to your question or even the comments soon. right, so thank you for staying with us. We have the doctor back now. Our guest is Dr. Chuma. Okay, Mark Olex. Doctor, can you hear me now?
Yes, I can hear you. Can you hear me?
Yes, perfectly. So this is the question we got, or the comment we got from one of our viewers, Beta Victor. This is what he's saying, that he thinks hospitals need to be monitored by government agencies, and a survey can be carried out by asking questions about the activities of the hospitals from people in the locality. If the hospital is found wanting, they must be fined heavily. What do you think?
I think that's just one part of the solution. The problem is complex. The issues around medical negligence is complex and requires a complex approach to it. It needs to be broken down. The monitoring and evaluation of hospital practices is one, but there are a whole range of issues of systemic failure in this because the incidence, the prevalence is very high. Think about 42.8% in some quoted research papers in Nigeria. And it's even worse with prescriptions, where it's about 92% of patients who go into hospitals actually come out with prescriptions of drugs they do not need. It's either they come out with us or they come out with drugs they do not even recognize because the doctors did not take adequate time to tell them the names of the drugs and the possible side effects. So these are all evidence of malpractices within our system here. So the problem starts perhaps from medical school. As medical students, I obtained my first medical degree in Nigeria, whilst I did my specialist training in the United Kingdom and the United States. And the stark difference in training is obvious. Whereas they tend to have a patient-centered bedside training, here a lot of our training is about how much knowledge you can exhibit, how smart you are, how intelligent, how clever you are. And when you look at a whole lot of negligence cases, a number of it has to do with communication issues, a lack of sympathy, empathy from the doctors, from medical practitioners, not knowing the right time to ask for help, behaving as demigods instead of individuals, and looking down on patients. So these are part of the root causes, and of course, poor training in a number of cases. So these are all a number of issues, a myriad of issues that need to be addressed if we are serious about tackling the issue of medical negligence.
When you say not knowing when to ask for help, is it in terms of the hospital asking for help or the patients themselves?
I meant medical practitioners asking for help. There are very few specialists. There are very few specialist trained medical practitioners in the country when you compare that to our population. However, we have a lot of practitioners who are dabbling in specialties that they were never trained for. They do not have a diploma. They're not, because after medical school, we do go for higher specialist training, which can take between 5 and sometimes 10 years after graduating. Now, very few doctors have achieved that, and those are the specialists in those fields. Now, the general physician is meant to, at some point, refer specialist cases to the specialist to deal with. But however, most doctors, or many doctors in our country, do not do that. They sit on the cases believing they can tackle it. So at best, they do a shoddy job. At best, they do a shoddy job when they decide to do that without the relevant knowledge and expertise that goes with that. So they have their reasons. Sometimes it's ego. Sometimes it's about commercial reasons. But whatever the reasons, the patient suffers. And when patient suffers, it causes a whole lot of pain and grievance. And some of them will decide they must seek redress as a result of that.
All right. So as a doctor, even in a Nigerian society, in hospitals here in Nigeria, how would you assess the performance of medical practitioners in Nigeria? How to deal with their patients in particular?
Like I earlier said, the key problem we have I have seen amongst my colleagues here is that of communication. First, there's poor communication between professional colleagues. There's poor communication that is amongst the doctors, then between the doctors and the allied health professionals, the nurses and co. Notes, records are not properly kept. Patients do not give the proper information when they're asked for information. Rather than give you accurate information, they lie about their past. So there's just everything seems to be wrong. And then secondly, doctors don't seem to be skilled in bedside clinical practice. Bedside clinical practice involves you taking your time to listen out to your patients, taking your time to show empathy, to show an understanding. You are not in a hurry. You have all the time in the world to talk to them, to be able to take in, give a good understanding, and explain to them, number one, if you're giving medications, the names of the medications and the possible side effects. If it's not medication, if you're asking for investigations, it's important to explain to the patient why that particular investigation is meant to be carried out and what you expect to have from it. But you know what? You ask 90% of your patients that visited our hospitals what medications they've been given. They have no clue. You ask them, they'll give you a request for investigation, and you ask them, what's the purpose of this? They have no clue. The doctor just said, we should do it. I mean, these are the real problems, because when things
Doctor?
go wrong, you know what's going on. Yeah, sorry about that. That was a call. So when things go wrong, it goes wrong everywhere. Patients don't know what to say. Nurses don't know where things are coming from. The lab
All right. So be a part of the discussion by joining
on those
us.
occasions
Let's
is
not
like a
just be the ones
demigod.
talking or the doctor talking. You can send us comments and tell us how you think the issue of medical negligence in Nigerian hospitals can be tackled. Or if you have questions or have any story to share, you can actually share at the comment section. And then we have a doctor here who will be able to respond. His name is Dr. Chuma Mark Olex, who is a healthcare management consultant and a specialist mental health practitioner. Okay, so doctor, let me shock you. So an empirical work by a researcher shows that 61.69% of Nigerian patients feel that the doctors in Nigeria are arrogant, or medical practitioners are arrogant and careless about their conditions and plights. Is that shocking to you, or how would you react to the statement?
It's not shocking, given the
Okay.
culture of our society. We as medical students, we are made to believe that we're like demigods, the best of the best. Go to study medicine. The arrogance starts from medical school. We are not actually taught how to deal with patients. We are not seeing patients as essential, critical to our practice. Even other healthcare professionals are poorly regarded by myself and my colleagues. So, as a result, our attitude towards others are oftentimes brim with arrogance. We know better. We know best. Take it or leave it. We play God a whole lot of time. And that is wrong. It's totally the wrong attitude. And those are attitudes that need to start changing at the medical school level. We need to introduce courses that has to do with bed manners, and also dealing with patients at that level. Medical students need to understand the value of really taking time to understand their patients and sitting with them, explaining things to them. Now, once we're able to do those, the arrogance will gradually dissipate at the level of professional practice.
Okay. All right, so we have the issue of Molara and also Peju. No, so Peju's family actually alleged their daughter died due to the negligence of health officials at a hospital in Lagos after she had a surgery with fibroid, and then it hit the social media, and people started telling their stories. You could tell that people had an experience here and there of how they've been neglected or they were not attended to. A story to tell about medical professionals in hospitals. Now, with these cases that are coming up, it's still said by researchers that a large number of victims don't come out to file lawsuits against the hospitals. Would you say that some Nigerians don't know their rights, or what do you think they should do when these things happen to them?
What I'll say is this: we need to recognize that the practitioners of medicine all over the world are human beings.
Okay.
And human beings do actually make genuine mistakes. But unfortunately, in medicine, when mistakes are made, they can either lead to serious injuries or death. The same applies to pilots flying aircrafts. So sudden mistakes result in serious injuries. Sadly, medicine is one of those. However, it excuses unnecessary mistakes. And that's why we have laws in our country that governs the practice of medicine and how to address any such. It's also important that we understand that there's a difference between negligence and malpractice. In the case of negligence, it's a situation where the practitioner unknowingly causes harm as a result of his action. Whereas malpractice is where he knows what should be done, but he refused to do it for reasons best known to him and did something else. Okay? And I tell you what, the ones we're hearing about are just a tip of the iceberg. But and these are because they are probably celebrities and names out there. These are things that happen every day. When there are statistics that shows about 92% of patients who go into our hospitals, actually, there's a prevalence in terms of prescription alone. And you know what? Prescription drugs are the worst culprits. They cause the most deaths in hospitals. And if you think a staggering 92%, it's not just the hospitals. When you go to the pharmacy, the local pharmacy, and you just mentioned, that you have a headache or malaria, you'll be loaded with 4, 5, 6 different drugs. They'll tell you have typhoid, you have malaria, you have the whole lot, and so it is a culture that's found its way into our society.
How can we tackle this issue now? This culture or this mindset by Nigeria, even like Nigerians, before they even get to hospitals, they load themselves with medicine. Self-medication is also an issue. But going to a hospital and not getting tests run on you and then getting that confirmation that you have so illness is also a big issue on its own. So how can the culture of negligence or the culture of self-medication end in our hospitals? Amongst us Nigerians?
Well, I think that's a totally different discussion point because it's a huge question that needs to be debated at different levels. Because the culture has been endemic from our religious background, our various religious faiths and core, where we do not believe in pursuing things to a logical end. We believe in forgiveness. And once you're asked to forgive, you let the person off the hook. And then he's free to do the same thing to the next person and the next person and the next person. Then secondly, there's absence of insurance, medical insurance for healthcare practitioners. Because with the presence of insurance, it's no longer the individual you're suing, it's the insurance company you're suing. And therefore, the insurance company is in a position to pay out and then address issues with that particular person. there are other issues in hospitals where you have lab diagnoses that are not reliable. I mean, you go to hospitals and the doctors, you bring some lab results and they tell you not reliable, they're not going to use it. So, and those ones are not being properly regulated, and that's a fact. I can tell you a number of labs that you can send patients to with symptoms of malaria. You know for sure they're going to give you a diagnosis of malaria and typhoid, which is not the case. So they didn't even bother testing. Yeah. So as a result of that, it erodes the confidence that the medical practitioner has in the lab results and other results coming in for him to help him evaluate a particular patient. Now, apart from that, we have patients that lie. They lie about their age, and a lot of illness and diseases are age-related. A patient who is 60 years old will come to hospital and tell you he's 35.
Yeah.
So you can miss an important diagnosis as a result of that. A woman with 11 pregnancies will tell you she's only had 3. Do you understand me? The Yorubas will tell you, I remember I trained at Ife, and they will tell you, Kinkomo, we don't count kids. They say, how many kids have you had, madam? Kinkomo, we don't count kids. And these are all important things that help in the process. So it's really a problem that really needs a wider discussion.
Better Victor, thank you again for your comments. So the example laid down by even the public hospitals and their pop facilities make the private ones feel like demigods. Just like what the doctor said, we need to look into the public hospitals. So the issue now, he says, according to his opinion, is the public hospitals. So what can be done in this aspect in public hospitals to check that medical negligence becomes a thing of the past? Doctor?
Firstly, it's training, and awareness. Having a number of practitioners are not even aware that it's a problem. Once they've done their prescription and you're out of the consulting room, you're just another number. So training, adequate training, awareness, raising the awareness, both amongst the practitioners and the patients. Patients are made to understand their rights. Practitioners are given adequate training. Secondly, we need adequate recruitment. Where you have a hospital where one doctor is serving several thousands, it's not healthy. Eventually, he's bound to make mistakes. When there's a whole lot of work, when he's doing 72 hours, 104 hours, I remember as a house officer at the University of Ife teaching hospital, I was working over 100 hours a week. That wasn't healthy. And that's the first year as a junior doctor. That was not healthy. And some weeks I was doing well over that. So it's important to recruit adequate number of professionals. That way the doctor can go home and rest properly and come back to work refreshed and able to think clearly. You cannot expect a doctor to stay up till 2 a.m. and just when he's about to go home, he's got an operating list in the morning by 8 o'clock. He's about to go home at 2 a.m. and emergency arrives. Okay? You expect him to deal with that, which he does till 4:30 a.m. Then you expect him to go home, sleep, and come back on an operating list that will go the whole day, from 8 o'clock to 6 o'clock. It's not. They're human beings. So it's important that we get the right number of healthcare professionals, allied healthcare professionals working in our hospitals. It's also important that we train them properly. Give them enough time, enough rest, enough training and support. And then perhaps look at insurance. Insurance, yes, insurance needs to somehow, the medical malpractice insurance needs to be put in place for all practicing physicians so that patients have, when they decide to litigate against a doctor, they know for sure that if there are compensations coming, they will get it. But when you just litigate against an individual doctors are not rich people. They're very poor. They're just surviving hand to mouth. contrary to the general opinion of the general populace. So these are real issues that needs to be done. And as it is, in Nigeria, we have laws that govern medical ethics. Okay, those laws already exist. The Medical and Dental Practitioners Act, as well as the rules of professional conduct for medical and dental practitioners. These are laws that have already been established to deal with erring doctors and healthcare
now that you
professionals.
mentioned the code of conduct and that medical practitioners actually have to follow, what happens to a doctor or a nurse or any medical practitioner at all that is found guilty of this kind of negligence? What happens to them?
Well, within the protocol and the act, there are two major options. It's either they get suspended for a period of time from medical practice and then sent for retraining in those areas, or in severe cases of gross misconduct, they get struck off completely from the register. This action does not preclude the petitioner from taking legal actions against them in a civil court. Okay? And where the issues are very serious, perhaps resulted in death, the applicant or the family can actually report the case to the police. And if police finds enough prima facie, they can take the matter up in a criminal court. So there are so many avenues. Apart from the medical and dental council, the police can actually investigate, and if they find sufficient reasons, they can take the case to a criminal court. Then it can also go for arbitration. Particularly, this tends to happen where there has not been any deaths. And arbitration can help in terms of looking at those things and seeing what compensation, if any, well, first, if any party is guilty, admitting liability, and what compensations can be reached. But my message to my colleagues and people out there is there are clearly ways to address this. But first, let us not allow it to get this far. And the way to do that is, first and foremost, important that my colleagues who are practicing learn the act of communication and empathy. It helps a lot. When you get the family, take them along in what you're doing in the process, they are more forgiving. They tend to be more forgiving because decisions are often made together. I can say to you, look, this person needs surgery. We need to get him in quickly, but you need to sign the consent form. These are the possible things. The surgery may go well, but the anesthetic agent may not, because some people die from not waking up as a result of that. It's a risk, but it's not a very high risk. If it's explained to you and despite that you sign it, you're less likely to get upset with me afterwards. But if I basically bring in your spouse and I wheel him off to surgery before you know what's happening, and then the next day you're coming in with food for the spouse in the morning thinking you're meeting him, only to be told that the spouse has lost their life, you'll be shocked. How? You ask a whole lot of questions. But if you have been taken along from the beginning, you'll know what's going on. You might even be around the theater, and that's where it comes to, we care, God heals. Yes, if you carry everybody along, you get to the point where it is left God to do the final bit. But there's no point you doing the work of God for him before then, which is sending them to the other side of beyond.
Powerful words. Yeah, okay. Powerful words, Doctor. Thank you so much for contributing today on the show. We looked at how to tackle medical negligence in Nigerian hospitals. And yes, we've had Dr. Chuma Mark Olex, who is a health management consultant and a specialist mental health practitioner. Thank you for your time again. So in summary, you've said a lot to your colleagues and even to Nigerians who visit hospitals. At one point, we have to go to the hospitals, right? And so we know what to look out for. So training should be there, should be training, insurance, improve on their insurance. And also, I like that part where you said don't overwork the doctors. You know, when you overwork them, they tend to, they're humans, they tend to make mistakes, right? Okay, so those are the issues to look at. Thank you for your time, and we hope that when we invite you next time, you will be available for us. Okay, so
No
you're getting
problem.
kudos already from our viewers. So Yunus Nas says, lovely contribution, Doctor. Thank you. Thank you,
Thank you
Yunus.
very much.
Okay.
Thank
And then
you.
Beta Victor says, and it might take years before all these can truly be resolved. I hope it doesn't take too long. In the nearest future, it will be a thing of the past. Thank you. And do have a
Thank you.
fantastic day, Doctor.
You too. Have a nice day. Be nice talking to you.
Oh,
Take
yes.
care.
Thank you. Yes.
Enjoy
My
yourself.
name is Sylvia
Okay.
Ishewe, and the show was produced by Hafsat Issa. To all of you who watched and contributed, we appreciate you. And all of you listening to us via our Mixlr account, Click Naija, and on our website on www.clicknaija.net. Thank you for your time. You can follow us on all of our social media platforms. On Twitter, we are Click Naija1, on Instagram, Click Naija, and on YouTube also, Click Naija. See you tomorrow for another interesting edition of Youth Assembly. Bye for now.
Thank you. Thank you. Bye.
Okay.